Yeah, just a quick review of the Aolabela patellar tendon knee strap. So these straps, a lot of straps around. This ones are more like bands. Actually, I would call them bands. So these bands actually decrease pain in your knee by decreasing strain on the patellar tendon. So researchers think that there's two ways that these work to do that. The first one is that they increase the angle between your patella and your patella tendon. So your patella is your kneecap, that hard bone that sticks out there. So it sits at a certain angle. And then your patella tendon is under it, and it sits at a different angle. So when you put this strap or band on, it increases that angle. And they think that's how it takes stress off of it. And so in turn, you get less pain in your knee. The other way that researchers think these things work is that they decrease the patellar tendon length. So that's where they're at with that. A couple points about these particular bands. These are alternative to the fabric ones. You see a lot of these fabric patellar tendon straps. And these are actually, I like these a little better if you can. Now it concentrates the force a little more in one spot because it's not spread out. It's not a wide band. It's kind of a pinpoint band. So you may have a little bit more discomfort with these. Just have to try them and find out. So having said that, I do like them because they are easy to clean. And you just put them on and they work right away. One size does fit all, so you can keep that in mind. And there is obviously no left or right to these things. So that's something good to know too. So yeah, other things you can do if you have knee problems. I get this from Bulletproof Your Knee book. If you have any kind of knee problem, make sure that you're definitely strengthening your quadriceps muscle. Your quadriceps muscle is a big muscle here on the top of your leg. So there's your kneecap for reference. It sits just above that. And basically, it's a big stabilizer of your knee. And so what they're finding is that people with various knee problems, basically they have either decreased strength or they have decreased cross-sectional area on CT scans, meaning that's actually smaller than normal. So those are the two problems. And so the problems they're finding are just about any knee problem you can think of. For instance, like knee swelling in the quadriceps. Look at this. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So here again, decreased strength means decreased stability in your knee, and that causes you all kinds of problems. Knee injuries in the quadriceps, if you've had anything like you've broken a bone, like your tibia, your lower leg bone, any surgical opening of the joint, you've had knee surgery before. When they look at people that have had those kind of conditions, they find they have decreased quadricep strength. Ligament problems in the quadriceps, anterior cruciate ligament, also known as your ACL. Here again, when researchers take people that have ruptured their ACL, they get looking at their quadricep strength. I mean, one study showed 25 to 30% decreased strength. I mean, that's significant. So here again, you don't get that stability in your knee, you're going to start having pain and other issues as well. Posterior cruciate ligament, same thing. Medial collateral ligament, here again, tear or rupture, quadriceps weakness is what they find. Knee pain, people that have chronic knee pain or even experimentally, they can actually decrease the strength of your quadriceps muscle. So if you just had chronic knee pain, chances are your quadriceps are weak. Knee arthritis in the quadriceps, that's an interesting one. A lot of research on the quads and your knee arthritis. Basically, they're showing in multiple studies that if you have knee arthritis, you probably have quadriceps weakness. And likewise, there are randomized controlled trials showing this. If you take people with knee arthritis and you strengthen just their quadriceps muscle, their knee pain starts to go away. And they also find that the arthritis progresses less in people that have the stronger quads. So the people, when they follow people for a while, like if they take a database of a bunch of people, how bad their knee arthritis is, how strong their quads are, and they follow them over time, they find, hey, the people with the stronger quads had less progression of their knee arthritis. So actually kind of interrupts the whole pathological process. Patellofemoral pain syndrome, this goes on and on. It's really interesting. Make sure you're definitely strengthening your quadriceps muscle. Here's something else, fine-tune control over your knee. This is another place to go. Here they're talking about your hip muscles. Sometimes the problem, you're having knee pain, but the problem is really up at your hip. The classic case is iliotibial band syndrome. So if they take a group of people with iliotibial band syndrome and they test their muscles, they find the hip abductors in particular are pretty weak. And likewise, here again, randomized controlled trials showing take a group of people with iliotibial band syndrome, you strengthen their hip abductors, it goes away. So it's really interesting stuff. Optimize knee flexibility. Of course, we know we can't have a flexible knee. It bends and straightens. What a lot of people don't know is that your knee actually rotates. About the last 10 to 15 degrees of you straightening your leg, that's called extension. Your knee actually rotates laterally out to the side. Well, that's actually a knee accessory motion that you need to have. And this little test will show you if you have it or not. It's kind of nifty. Let's see. Another thing you can look at is dynamic. What is it? Dynamic? Yeah. Dynamic knee stability. Here they're talking about proprioception. So basically, if I turn the lights out right now, you'd be able to tell me whether your knee is bent or straight, and that's because of your proprioception, your position sense. You have receptors in your knee and your knee joint and the muscles that give your brain constant feedback as to where your knee is in space. So that's your proprioception. Interestingly enough, when I look at people with knee pain, they find that their proprioception isn't really what it should be, and with various other knee problems. So basically, that's something that you can actually do some exercise to improve your proprioception, improve the functioning of your knee. But yeah, lots of stuff you can do. Hey, but nothing's as quick as putting on one of these little bands, and they have been shown to work. So yeah, check them out.